Throughout the day, we're going to have some of the nation's really leading preeminent health policy experts are going to be here, and I'm really honored that they would join us.
The creation of an essential health benefits package could not be more important for people with cancer and other life-threatening chronic, or what we usually refer to now as NCDs, non-communicable diseases.
The goal really is this: ensure that all plans offered in the marketplace are affordable and comprehensive, without the gaps in coverage that too many people are seeing today.
For us, and I believe for this country, solving the healthcare challenge has everything to do with fulfilling our generational responsibility. That old-fashioned notion every one of us was taught by our grandparents, that we, in our time, are supposed to do everything we can to leave things better for those who come behind us.
I think the decision to give the essential benefit package designation to the states, at least initially, was just a prudent one from a time standpoint.
At the end of the day, I think we do want the essential health benefits to accomplish two things. One is to make sure that health insurance coverage is real, that it's adequate, as Dr. Sefrin talked about this morning. And that is not the case today. Overwhelmingly, the problems of medical debt and medical bankruptcy are problems of the insured. So we have a lot of people who are underinsured, and their coverage cuts out right when they need it most.
One shortcut here is once we know what that largest selling small group plan is in every state, it's a safe bet that that's going to be in play as we get to September as the default. That's what happens if the state doesn't agree, and my guess is in a lot of states, trying to make a new definition of essential health benefits between now and then going to prove pretty tough.
I believe we will see fee-for-service diminish as a factor, and I think fairly rapidly. Rapidly is defined by how quickly will this economic dispassion begin to fold into it. But the world is now organizing itself of health into networks to find more efficient ways of delivering essential benefits.
Maybe one of the biggest innovations is actually how do we deliver the care and how we make changes so we can get back to taking care of patients instead of some of the other things that go on in our everyday lives that we find so frustrating.
There is an enormous amount of complexity, again, as we've had reference during the course of the day, in the selection of the benchmark plans, in the myriad of decisions that the states are going to have to make, and frankly, the federal government is going to have to give us guidance on going forward.
It's important to recognize the ACA does have in it, in Title III, probably, I don't think there's a parallel for a federal law that has so much in it that is attempting to get at quality improvement and cost control in the U.S. healthcare system.